Welcome back. Today we are talking part 2 of fibromyalgia's frustrating fiasco, the ridiculously long list of symptoms with fibromyalgia. I'm Sharon, she's Ginevra. We started this talk last week. That episode is down below. You may want to watch it first. If not, do it whatever works best for you. But here's part 2.
So this is kind of a way to look at some of the other commonly described symptoms with fibro. So like blurred vision and I think eye fatigue or easily fatigued eyes. We talked about that in other episodes, but like why we started to love Audible so much and things like that. Easy bruising, nausea that comes out of nowhere, hair loss that's not really able to be explained by other conditions. And then I see a lot of food sensitivities or intolerances. This is different than an allergy. It's basically foods that you ingest that generate an inflammatory response in your body. And it's really important to look at because it can make a big difference as far as treatment. It can, if you can find those triggering foods and eliminate them and work on healing your gut, it can actually make a difference as far as that overall flu-like aching. So if you want to learn more about that, I talk about that in the Fibro Manual and in the Fibro Food Formula, which you can get for free if you sign up for my email newsletter on drginevra.com.
That's really helpful. And yeah, the food thing, I always talk about getting 1% better because each 1% matters. And there are things that we do that sometimes make us 5% better, 10% better. For me, the food, I got about a 40% or more gain when I gave up gluten. That feeling of not being able to wear clothes because it was just so painful to have clothes touching my skin went completely away when I was solidly off of gluten for 3 months. I had attempted it at other times, but I didn't fully realize that I was still getting a little bit of gluten here or there. But when I did a very, very strict 3 months, no gluten, then I noticed it. And while it was hard to give up gluten, once I got rid of that pain, it was a total game changer for me. So
I totally agree. Yeah, same for me with dairy. I would say when I dropped dairy, when I was first diagnosed, I felt like maybe 20 or 30% better. And that all over achy feeling in every muscle, that really dissipated for me. So we're not saying that dairy or gluten necessarily are a problem for you. It's very individual and not everybody's sensitive to the same thing. There are people with fibro that don't have any food sensitivities. I would just say most folks have something that they're eating that seems to kind of generate some kind of inflammatory response.
Yeah, and I think what's really interesting with what we're talking about here is the fact that every organ system of the body really is impacted by fibromyalgia. And here's a little list of all the systems in the body. And if you look at what we've already talked about, plus add maybe some other ones on, you'll see that every system is impacted. I even, as a result of a post I just had on the Fibromyalgia Association website, or rather on our Facebook page, which is found at facebook.com/Fibro Association, we had a post about this very issue, how we're so sensitive to various stimuli. And I compared it to the Princess and the Pea fairy tale, that we just have this sensitivity that other people do not have. And it's to things like sounds and smells. And, so that would be like going to the movies for us. The sound may be too painful to sit through a movie or impossible to sit through in a concert situation, which is why I always bring some sort of earplug with me. And often I'll have to wear those to sit through the movie. I cannot be around colognes and perfumes. It's really difficult if I am. That's gotten better over time as I've treated more of my fibro symptoms. I notice if I'm more in a flare, I'm more sensitive. But that for sure is a problem that many people face. And And these things are so awkward as far as like it's so hard to understand this if it's not happening to you. So it makes it really hard for us to share with our family or friends or coworkers the experience we have just by sounds and odors and different things. And so it can be really difficult to talk about these things. Um, and
Sharon,
I
you
want
said earlier, like, your cologne is killing me. I think that sometimes that's not an exaggeration. Like, we can be so sensitive, like it can just feel toxic to be around somebody's
oh,
perfume.
I would need, Tylenol for a headache from that, and, it would take me hours for, like, that to pass, and even sometimes nausea, I actually know people through my work at the Fibromyalgia Association, for 28 years that, like, throw up and really have, like, acute responses to it, so it's no joke, and it's a complicated part of living with fibromyalgia. I wanted to share when I posted this on our Facebook, we had a comment here that I think goes nicely with what we're talking about. So, this viewer on Facebook wrote about 15 years ago, there was a great website with a monster list of fibro symptoms, impersonal yet comprehensive, that can no longer be found. Um, some people have found their own selective list of their personal symptoms. I am all for personal advocacy when we're able, but these personalized lists do not include every known and potential symptom like we're talking about here. When I suspected fibromyalgia with a prior diagnosis, I was able to print it out, tick off all my current experience symptoms, and show it to my GP, who in the UK are only meant to deal with one singular medical complaint per 6-minute average appointment.
Same in the
Obviously,
US.
right. Obviously, this is not an optimal system for such multi-symptomatic and complex conditions. This list was a vital part of my diagnosis that left me with a comprehensive list of other symptoms to look out for, and it gave me, alongside with my positive anti-nuclear antibodies blood test, a referral to a rheumatologist who confirmed that I have severe fibromyalgia. New people with suspicions no longer have this tool at their disposal, just different lists. So that got me thinking. I'm like, I want to search. Could I find something like that? So,
Where's this list?
yeah, where is this list? So I'm sure this viewer, has looked for it herself and hasn't found it. This was the closest thing I could find to it. This was perhaps the largest, craziest list I've ever seen. And it says the ridiculously long list of fibromyalgia symptoms. And there were like 200 plus symptoms on here. And I know, Ginevra and I, we were talking about it a little bit. And there's certainly, take all of this with a grain of salt. Like, I'm not sure that this is totally helpful, except to say that it does kind of break things down into these categories, which is interesting, which again go back to like, wow, fibromyalgia impacts every aspect of our body. And it goes into here, we're showing on the screen the sensitivities. So how, again, the princess and the pea with you name it, any stimuli, that's us. So that being said, what also is generating our interest in doing this particular topic today is you cannot dismiss everything as fibromyalgia, which too often can happen as well. I have a friend and a member of the association who was having chest pain, and her doctors were dismissing it as fibromyalgia when in fact she was actually having a pulmonary embolism and nearly could have died if she didn't keep advocating that, no, I think this is like something different. And she kept pushing to be heard. And I think you had a story like that too, or
I have so many horror stories like that, and I don't mean to, like, bash other doctors because, it's a hard job, and they're doing the best they can, but part of why I think it's so important for us to know what our fibromyalgia is like what common fibromyalgia symptoms are, so that when, like, those maybe outside of usual thing happen, you can say like, "No, no, no, this is not normal. This is not part of my fibromyalgia. This I need to go to the emergency room. I need this to be like worked up." So I'll give a couple examples of that actually towards the end, and then I also have my little 2 cents about that very amazing list monster list of symptoms, which actually is kind of useful, I think, to kind of just look at like, oh, wow, I'd never thought of describing that feeling in that way. And maybe then that helps us to kind of have different vocabulary or language to speak about it with our doctors. I wanted to just mention, when we're talking about dizziness and fibromyalgia, this also comes along with kind of balance issues and a predisposition to falls. And so I think it's partly related to dizziness, partly probably related to blood pressure issues. People with fibromyalgia tend to have a higher rate of falls. And I think, Sharon, there was a study that you were talking about that we can actually link in the description below that
tells a little bit more about the rates and incidences
Yeah.
if you wanted to have that and show it to your doctor.
But that is something that I absolutely see 100%. And so then this is kind of, the last of the laundry list of symptoms of the ones that kind of were the standout ones for me. So the ones that I think are maybe the most common among people with fibromyalgia. And so that's everything on this slide, along with low blood pressure, hives and rash and itching that aren't attributed to something else. If you have a rash and you know what it's from, probably not fibro, but if it's like, I just have this random rash sometimes, and sometimes I have itching in my foot for no reason, that can really be related to fibro, along with sensitivity to sun, sensitivity to light, sound, scent, substances, like you were talking about. Frequent urination, even if you don't reach the point of what we would technically call overactive bladder. I will say many of us have like walnut bladder, where it's like, yep, been 20 minutes, I gotta go again. I 100% see that in fibromyalgia, and also have that myself. And then dry eyes and dry mouth. I think that is something that I'm just recognizing more as kind of more viewers respond. And as I dive deeper into the medical literature, it's like, oh, that actually does happen with some frequency with fibro. And what that brings up for me, and if you're somebody that's like, hey, wait, is fibromyalgia an autoimmune syndrome? I'm wondering about that. And there was that mouse antibody study, and wait, but my doctor said it's not autoimmune. So the jury is still out. We don't know if fibromyalgia is an autoimmune disease, meaning it's like part of the process is the immune system attacking our own body and causing symptoms. We do know a couple of things, though, that people with fibromyalgia are much more common to have diagnosable autoimmune disease like Sjogren's, and Sjogren's syndrome is associated with dry eyes and dry mouth. So I kind of wonder, when we're looking at how frequently people with fibromyalgia describe dry eyes and dry mouth, I wonder, like, well, does that mean they actually have Sjogren's, but we just haven't evaluated them or diagnosed them with that? And there are specific tests, there's antibody tests, and actually they can do some biopsy tests to see, like, hey, do you have Sjogren's or not? But this is an area that really we're just starting to look at scientifically, because for so long, the party line has been, nope, fibromyalgia is definitely not autoimmune disease. It's just 100% neurological, and it's just related to pain sensitivity, and that's it. But as you can see, we're talking about a lot of different body systems and a lot of different problems. And so it does start to make one kind of curious, like, are there some autoimmune aspects of fibromyalgia that we're actually seeing in all these symptoms? Or is it just kind of the maybe there's autoimmune syndromes coming along with it? Or is there some other cause for the dry eyes and dry mouth? Is it a more neurologic cause rather than immunologic cause? So
And I was just going to say, about 15, 20 years ago, working in this space, there were researchers telling me that they were looking into whether there's types of fibromyalgia like diabetes, and that they were hoping to maybe discover more of these types, which would then lead to targeted treatments if they could understand, well, using this example, well, this is more of like an autoimmune response type of fibromyalgia. And so I've never heard that really go anywhere since then, but for a couple years, that was like a pretty good buzz that was being worked on. And I'm not sure if that's still a thing that they're working on, or. where that got left.
That's a great thing to bring up. I will say there are still some corners of the fibromyalgia scientific world that are looking at that as far as, are there specific types of fibromyalgia? Like perhaps, yes, one that's more driven by immune system issues, one that's more driven by neurologic issues, one that's maybe more hormonal. And there's been all sorts of attempts to sort of make different categories and figure out different ways to try to group people together. And the reason why it's never really come to fruition is because we don't actually fundamentally even know enough about fibromyalgia globally to be able to then piece it out. Like, imagine trying to figure out the different types of diabetes if you didn't know what caused diabetes, if you were just based on the symptoms. Doctors would be incredibly confused, right? Like, that's so weird that your urine is sweet and that you have nerve pain. I have no idea why those are connected, but because we know of blood sugar and insulin and how that works in diabetes, we can then subcategorize it. Sadly, we aren't even really on that first page, like where diabetes was 80 years ago. Like, that's where we're just finally coming into. So I think that we're going to learn a lot more, particularly with this new immune system data. If we can actually, if there's like antibodies that we can test for, like, oh, okay, everybody that has these antibodies, yeah, that would be the immune category. And, maybe everybody that has it after COVID is a post-viral category. And I think that there's a lot of potential, but it never kind of went anywhere when they were trying to do it about a decade ago, because I don't think had enough information. But that is a really good point. And maybe there are subcategories of fibro and we'll figure that out. But early days yet, sadly, as far as what we know about fibro. And this brings me to just kind of a few things I wanted to say. If you feel that something in your body is happening that's different than fibro, definitely advocate. If your doctor is like, that's just part of your fibro. If you feel like, oh, I know in my gut this is different, or, I've looked on the forums and it just doesn't seem like this is fibro related, this is where you have to advocate for yourself. Because like, if your support group member hadn't said like, this is different, yeah, it could have been a totally different outcome. And I have seen this quite a few times with, I had a patient that had fibromyalgia and I'd been caring for her. And then she developed tremors. And she saw a different doctor who said, oh, that's just part of your fibromyalgia. And I was like, hold please, like fibromyalgia does not cause tremors like that. And so I said, let's get a second opinion, send him to a neurologist who said, oh, this is actually Parkinson's in addition to fibro. So that's the other thing to keep in mind, is just having fibro does not, unfortunately, make us immune to all those other illnesses that can happen to, human bodies as we age. So I would say just listen to your gut. That's a really strong indicator. And if your doctor is not giving you the answer that you want, ask for a second opinion. See another doctor. Like, you just have to keep at it sometimes.
And don't be afraid to advocate for yourself.
Yep.
It's okay,
Totally.
because nobody cares more about your own health than you do. So you have to be that final voice of saying no, no matter how not confrontational, but
Uncomfortable?
it's how uncomfortable
Yeah,
you are when you're
for
like,
sure.
you want to just like go, okay, that the doctor gave me this answer and I just need to forget about it and move on. But if you know something's wrong, it's really worth being uncomfortable and doing what you need to do to find the next opinion.
And it's really sad that we have to do that. It's sad that so many doctors don't understand what fibromyalgia is well enough to delineate what it isn't. So I think I've often joked, although it's not a very funny joke, that I should have some sort of like game show, like, is this fibromyalgia? Ding, ding, ding. No, it is not. Next contestant. Yes, that is. Like, because
Maybe we'll play that here someday.
I don't know. Will anybody go to that game show? It's not a fun game show, but
No.
it could be a really useful game show. And so interestingly, I had a kind of a similar take when you looked at that ridiculously long list. I also looked at it, and it was interesting because they listed over 200 different fibromyalgia symptoms. And I found, I would say maybe 70% of them, I felt like with kind of my medical expertise, I was like, yeah, okay, that I could see that being part of fibro, or yeah, I've had patients talk about that. And then there was some where I was like, oh no. And I'm worried that a doctor's going to look at that list and say, like, oh yeah, that's just, your heart attack is because you have fibromyalgia, or that seizure is because you have fibromyalgia. So I think it's interesting to take a look at this list, and we'll put a link in the description if you want to check it out. But definitely take it with a grain of salt, and know that maybe not all of them are 100% medically accurate, but we do learn a lot from each other and from each other's experiences. And the one part that I think they nailed spot on is this list of sensitivities, which is exactly the same part you called out separately in research for this episode. And so this leads me to, I like to kind of have a little bit of I don't know, I guess it's a joke, but not really. I think that our super senses, our hypersensitivity to smells, for example, or sound, can actually be viewed in some ways as a superpower. And I say this because a comment on our last episode was somebody saying, like, oh, the sound sensitivity, that's why I'm a good audio engineer. I was like, oh yeah, that would make you a really good audio engineer. And I've long joked that my fibromyalgia superpower is, I think if there's like a molecule of something burning within 100 feet of me, I can be like a human smoke detector, like ding, 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 something is on fire, like way before the smoke alarm detects it. Like I will detect it before. So I'm not sure how useful it is, but I think it can be nice for us to reframe it a little bit and be like, oh yeah, that's my fibro superpower. Do you have a fibro superpower?
I would say the same thing. It's sense of smell. I will know if, oh, the food's getting done, or, is there, just the other day, this week, I'm like, I opened the garage and I'm like, what's that gas smell? I'm like, is the
Yes.
car leaking? I'm like, this isn't right. There's too much gas, And I found out
Totally.
that our snowblower, this was a bigger example where I think most people would have noticed the snowblower, but I can do that with very little,
Oh,
less
yeah.
less smelly things.
Yep. And so this, what I'm going to call it out. They say sensitivity to odors, able to detect and or react in concentrations far lower than before they had fibro, and that healthy people cannot smell. And so, yeah, maybe this is our weird superpower. And then I also want to say that there's a couple things that after I did this list, I was like, oh, I actually forgot. So things that I would add on to kind of those orphan extra symptoms of fibromyalgia would be decreased libido, low testosterone in men with fibromyalgia, and worsened PMS and menopause symptoms, and kind of hormonal symptoms in general. And there's I have a whole chapter in the Fibro manual about hormone imbalance, super common in fibro. But I just wanted to kind of put that in there as well. So even somebody who, literally, my profession and my personal experience is trying to be an expert in fibromyalgia, like there's still things I'm like, oh yeah, I forgot that one, because there's so many. And I think that's why you call it the flustering fiasco of
Right, yes, it
frustrating.
is the Fibro's frustrating fiasco, because it's just so many, and I love the name in this, website, on the ridiculously long list. It's a ridiculous list,
It
and
is.
I know when people talk to me, or, we see the comments here on the show, and they're like, and they rattle off like 10, 20 things. And it's so overwhelming. And it's so overwhelming when we present this at the physician's office. And that's the piece that I think we're trying to do here on the show, is to get this information out there so that um, we can start to normalize this. And yes, this is fibromyalgia, this big picture like this, so that when physicians hear these things, it's not, wow, this person might be a little bit, crazy or something,
Mhm.
because it's this list. It's like, Oh, no, we need the response to be, "Wow, well, geez, that's making me think it could be fibro because there's so much going on here." We
Yes.
need to change that. Yeah.
In fact, the new 2016 kind of survey diagnoses that they developed, one of the categories is actually like how many of these kind of all these broad, they call them somatic symptoms, but basically things like nausea or headache or other types of bodily symptoms. If you have enough of them, that actually scores kind of 1 point towards a fibromyalgia diagnosis. And we're almost out of time, but the last thing I wanted to say is this is where I've had a lot of people ask me, like, well, how come I have mild fibromyalgia symptoms and somebody else has more severe? And I think it usually comes down to how many of these kind of comorbid conditions somebody has along with fibro, as well as how many of these additional symptoms. So everybody with fibro has some of these extra symptoms, like IBS. I don't really run into many fibro patients that don't have IBS. But if you just stack all these on top of each other, then you can see how somebody could be so debilitated by fibro. And that's where trying to work with a doctor to piece out, like, what can we treat to help you improve, get that 1% better and add it up. And I think it can help people to understand, like, oh, right, okay, this is how there can be such a broad spectrum in how people are doing. And it helps us to have compassion for ourselves and compassion for others. And we're all about that here.
We are. And a big takeaway from today's talk, if you take away nothing else, please take this away. You can get better. We are not throwing all of this at you that, oh, this is your life and this is how it's going to be. There are ways to get better. As we say, many of these other conditions that you brought up in your list have treatments.
Yep.
There's a lot of things. In one of our next episodes, we're going to address the eye fatigue thing because that's such a big one. And I have a few tips for that we'll share soon.
Oh, yes.
And that
yes,
does
dry eyes. We want people to share their tips for managing dry eyes. We get that a lot.
absolutely. And so there are different things you can learn through, like, coaching, which I happen to be a health coach and I do work with clients at hwcsharon.com. And pain psychologists have tools as well. And then your doctor has tools. So there's all these specialists in between: physical therapists, occupational therapists, pelvic floor therapists that can become a part of your team to address all of these things. And as we say, like right at the beginning of this video, when you start to address one thing, it often has a positive influence on these other conditions. So
Yeah.
it's really important to address all of these things. And don't get overwhelmed because it's a lot to think about. Just a day at a time, a symptom at a time. Just take it slow.
And we want you to know that we are on your team and we are sending you all some of fibro love until we meet again.
And please subscribe, like, and hit the bell. That helps us get fibromyalgia out there and known to everybody, not only you. Thank you for watching.